Hi, Dr. Belziki. It's good to see you again. We are going to see another 5-minute case. So the floor is yours.
Patient showed up in pain, composite resin on 36, which I'm never fond of, broken buccal cusps. This tooth seemed to be the one that was offending, and you can see the impact at 38. This is just a different view from the lingual. Radiograph. So the idea was to get him out of pain. Taking out the pain was being caused by the 37, not the 38. So what to do? And this is a difficult extraction if I leave this in place, but this has to go also. But I gave thoughts to what happens if I leave 27 unopposed. I would take out the 28 at a later date. I thought if I leave 27 unopposed, then that would start to over-erupt. Patient is new to me. These are not my restorations. I would never use composite resin on molar teeth like this. You can see there. So what I did was sectioned the distal root from the second molar, started the endo, didn't go to completion because blood, it was very difficult to isolate this. And then that made taking out the third molar easy. And that's what I did. Removed, did a pulpectomy, and then just placed some resin in to restore the broken buccal cusps on that tooth. Sent the patient home, came back on a subsequent appointment some months later, and I completed the endo in the mesial root and prepared those two teeth. The tissue was not optimal because he hadn't seen a dentist for years. So I did go on to do an additional periodontal therapy. Here you can see the distal of the mesial root. Prepared both of those teeth, made provisional splinted crowns, sent the patient away and said, come back in a few months when the tissue looks a little bit better and firmer, we'll go ahead and take final impressions. And here you can see why I wanted to keep some semblance of 37 because it would hold the 27. Out of sight, out of mind, didn't bother him. So a year and a half went by and he phoned me a few weeks ago, Doc, the temporary broke. Thankfully, I used polyF cement, which had not washed out and left these provisional secure. Here you can see the upper arch again. This tooth is continuing to erupt. That's the 28. I don't want that to happen to the 27. Took off the temps that were in place, and I said, thankfully, polyF left the tooth structure in good condition, but the skin was all beat up. It just didn't smell right. It accumulated a lot of plaque. I was able to get an impression. Here are my two splinted, two crowns that are returned in sections. I did solder indexing in the mouth. There you'll see that's the solder joint. It's returned, completed. The tissue has had a chance to heal. I did have to fabricate new provisionals when he returned. So now you can see pink, healthy textbook tissue from the lingual aspect. I did go on to do endo earlier for the 26. No, I didn't. Sorry. So there you have it. That's the case completed very, very quickly in 5 minutes.
Perfect. Thank you very much, Dr. Belziki.